emergency physicians. And today we're going to hear about the state of emergency care in the United States, but we're going to focus on the support for the emergency care system right here in Minnesota. After some brief remarks from myself, we're going to hear from Dr. Bill Heegard from the Hennepin County Medical Center, also past president of Minnesota ACEP, as well as Representative Schoen. We're also proud to be joined by other key stakeholders in the emergency care system right here in Minnesota. After each of our speakers has made a few remarks, we will take some questions. The recent release of the ACEP report card provides an evaluation of the support for the emergency care system on both the national and a state-by-state level. The report card measures conditions under which emergency care is being delivered, not the quality of care provided by hospitals or individual emergency providers. The report shows that the healthcare system for emergency patients is under great stress. Due to the current national and state-by-state policy environment, the nation received an overall grade of D+. Since 2009, the last time ACEP issued such a report card, Minnesota's support for emergency care has declined from 6th to 12th in the nation, earning an overall grade of C. Since 2009, Minnesota's grades declined in 3 out of the 5 individual categories of the report card, as you can see here: access to emergency care, quality and patient safety environment, and disaster preparedness. Investments in quality and patient safety in Minnesota, such as enacting laws to strengthen EMS and trauma, will pay dividends for all emergency patients for years to come. Regarding disaster preparedness, we have learned that major incidents can happen anywhere and any time, such as the Boston Marathon bombing, as well as even close to home, such as the 35W bridge collapse. A well-orchestrated emergency response means a difference between life and death, but our state could also improve its disaster response rating by increasing funding to help those patients with chronic illnesses, such as those on dialysis, those with mental illness, that are very vulnerable during a disaster. The state can improve its access to emergency care grade by increasing insurance coverage for children, as well as by increasing the number of psychiatric beds in our state. The 2014 report card forecasts an expanding role for emergency departments under the Affordable Care Act. It underscores the harmful effects of the competing pressures of shrinking resources and increasing demands. The report card should be both a wake-up call and a call to action to state and national lawmakers to make it a priority to strengthen our emergency care system. This is precisely why we have called upon each of you to be here today. I'd now like to invite Dr. Bill Heegard to make a few comments.
Thanks, Tom. Good afternoon. First, I want to say thanks to all the colleagues that are here because you're looking at what keeps Minnesota safe, especially in a disaster. For the past few minutes, you have been hearing about the state of emergency care in the United States, and more specifically in Minnesota. It should be obvious to all that we still have plenty of work to do to ensure that emergency care is functioning at the highest level in Minnesota. To that end, Minnesota ACEP wants to work with legislators, public health advocates, policy experts to create programs and legislation that will improve emergency care for all. I am proud to announce that we support and will actively work with legislators to advance the recently introduced trauma bill in Minnesota. The Level of Readiness Trauma Hospital and EMS initiative will improve trauma care and EMS care throughout the state of Minnesota by investing in our trauma and EMS systems, coordination, and training infrastructure. Representative Dan Schoen and Senator Jeff Hayden have authored this bill. We are fortunate to have Dan to get to here today with us. As a police paramedic, Representative Schoen is uniquely qualified to understand the critical need to protect access to emergency care throughout the state of Minnesota. Likewise, Senator Hayden has a long history of advocating for EMS and trauma care in Minnesota and clearly recognizes the importance of access and availability of emergency care in the state of Minnesota. With that, I'd like to ask that Representative Schoen, he could be a doctor, come up to the podium and please talk about the legislation.
Yeah, look at my salary if I'm gonna be promoted to doctor, right? I appreciate
I
it.
wouldn't feel so confident.
Well, you know, every day in our communities, 24 hours a day, we have people at the ready at the hospitals, in our fire stations, in our ambulances, waiting to respond because we care about our families. And to have a downgrade in our trauma care report card is disturbing, and we need to do better, and we can do better. We have taken those investments very seriously, and at this point, for less than $1 a month, we're going to ask Minnesotans to help us invest into training, the infrastructure, to make sure that we have those services available around the state from border to border, east to west, north to south. Whether you're in Windham or Wilmer or Woodbury, you're going to get the service that you need. You're going to have highly trained individuals responding, whether they're first responders that are leaving their jobs in Clare City, Minnesota, or that they're Minneapolis firefighters or Hennepin County Medical Center paramedics. They're going to be top notch, and that's what we need to continue to strive for, no matter where we go. This is a great piece of legislation that really invests in what is important to us. We have made great strides around the state with transportation infrastructure that gives us safety ratings. We look at cable barriers, and I know every day when I go to work, and this last week with the spinouts that we've had and cars crashing, we don't have cars going across US Highway 61 in Cottage Grove anymore because there's a cable barrier there, and I know that saved lives. But crashes are still going to happen. We have highways in this state that just aren't designed with those safety improvements, and they still need much improvements all over, down in the Mankato area especially. Quite frankly, the crashes and the traumas are still going to happen. Over 60% of all the trauma-related cases that come into our trauma centers are from automobile accidents. So that's why we look at the automobile policy as our starting point to say, where can we invest? How can we invest, and how can we make this better? So with that, we'll take some questions from there.
Can you explain where, the funding comes from then for this proposal?
Absolutely. So what we're proposing at this point is a annual fee of $10, so less than $1 a month, that automobile insurance policy holders would pay. That would go into an account set up by the Department of Health and administered through there. We figure that's going to raise a revenue in the area of about $20 million a year.
And I'm just curious, have similar proposals been tried in the past legislatively, or is this a new idea?
Well, I think this is a new idea on this particular front for Minnesota. There are many other states out there that do have programs in place that fund these types of things with different measures. For instance, I mean, you go to other states, and their other states are their state police departments will run the medical service helicopters. Here, it's not the state run, so the state patrol doesn't run the medical care helicopters. But we need helicopters all over the state, ready and available to go. But they're expensive. Ambulances are expensive. The tools to cut you out of cars are expensive. The research that we need to do to train our surgeons and our emergency room doctors, that doesn't come free. And I'll tell you what, when my family needs the care and something should tragically happen, I want them to have the best chance that they had. When I was in first grade, my dad got into a terrible crash with a gravel truck. And I remember he had been down at the U of M for, it seemed like an eternity, unconscious. Thankfully, he's alive today because of the care he got. Now that was when I was in first grade. That was more than a couple days ago. But trauma care has increased, has gotten better since then. But even over the years, our available readiness has decreased. And so we need to do better. We're watching across the country. We've had a bridge collapse, and what do we need to have in place to be able to respond? How do we open up more beds? How do we make it available so that when we have a surge type situation, that we have that infrastructure in place? How do we train for it so that everybody knows how to use it? And not only that, but when we get people to come into Minnesota to do their residency or to train to be an emergency room physician, a trauma doctor, whatever, and they get to be good, or that we can attract high-quality people, we want them to stay. And this is a tool to help us do that.
Can I add one thing?
Oh, please, come on over here, Bill.
The trauma system, just so you know, to add this, our trauma system, the state of Minnesota was insightful enough to fund creating a trauma system. In fact, the gentleman back here, Tim Held, was very involved in this. So, and it was decades of work with some really dedicated individuals. But what they did is develop a system. What they didn't do is fund the providers. And that's really important. So really the goal of all of this is get the right resource to the right place at the right time so we can get you, the family member, the individual, to the right hospital. And that hospital might be Wilmer, it might be International Falls, it could be any of the major trauma centers in the Twin Cities. But that system, since we've made all this work to coordinate it, the only way it works is if we have providers. And that's a challenge, especially in rural Minnesota for EMS providers. So I think this bill really addresses that.
And maybe you already hit on it, but a little bit more as to why you think we are slipping in the report card rankings. Do you think it's a matter of just having the funding, or, you know?
I think it's very much multifactorial. I think, I alluded to that we're having this situation where we have increasing demands and shrinking resources. And I'll give you an example. From 1995 to 2010, the emergency department visit rate went up 34%. At the same time, the supply of emergency departments went down 11%. So essentially, we're being asked to do more with less. And I think that's kind of the overlying reason why we're having the majority of these problems. It certainly comes down to the funding, it comes down to policies that are in place that are not in place at the current time.
When you talk about some of the grades from 2009 to 2014, and overall the rank has gone down as well. What are the critical things? Quality and patient safety environment. It ranks a D. Can you explain a little bit more of what that is exactly?
I think the reason that is so low, interestingly, since we have many of the providers here today, is that our EMS system right now lacks funding to develop field triage protocols that could, like Dr. Hegard had said, selectively triage patients to their correct destination, whatever it is that their condition may be. We don't have funding for a state EMS medical director that can help us standardize care and increase quality. Those are two big areas that we feel that we can improve on.
I think of the disaster element, I want to be clear. I'm a big believer that our EMS system and our trauma system, when you read in the detail, you'll see we have some of the best per capita ratio for trauma care in trauma centers. Our emergency physicians that are board certified and our EMS providers are tremendous, but it's a big area. And so when you drill down like in disaster, we were, I believe, an A-, and now we're significantly below, like a C-. Well, some of this is, the good news is some of the nation has caught up to us, but some of this is really in the details. And Aaron Burnett is here, he knows a lot about disaster work, but during Sandy, Hurricane Sandy, there was specific real challenges with dialysis patients, with patients that have complex medical issues, mental health, vulnerable populations. We're working on this. John Hick is very involved, both federally, at the state level and federally. We know we can do better. I think that's a little bit of an anomaly because we have 2 mobile medical units. We're light years ahead in many areas, but that is an excuse. We got to improve. And our ICU, our ICU numbers, when you look at compared to general hospital beds, the ratio is relatively low. But when you look at per capita and our ability to handle surge capacity, which we want to keep in the state at the very best, is outstanding. So we still have a lot of work, but a lot of it is kind of getting up to the next level.